as he was educated in Oxford University, and currently he is practicing in Italy, Los Angeles, Switzerland, and also in Middle East and Africa. And the topic of his lecture will be treatment of vaginismus, acido-botulinico, and sexotherapy. You're welcome.
Thank you for this presentation. Thank you for my lady, Dr. Tina, for inviting me, and Dr. Mostafa, and all the board to invite me to be here among you. And which is amazing is that I cannot imagine and believe myself, because I failed 3 times in the exam of gynecology. I was always dreaming being a gynecologist, but I did not do it. I moved to the aesthetic plastic surgery. So it's not more better. Today, I would like to speak about sex. When I'm speaking about sex, I see different faces that are moving around left, right, to the top, to the down, but I don't know why. When we are speaking about sex, there is a lot of fantasy. For example, every one of us, while I'm speaking or I'm saying sex to him or to her, there's something that is in mind blowing. 50 Shades of Grey, maybe, different positions, Kama Sutra. Me, for example, I'm speaking about Samantha Jones in Sex and the City, which was my idol, the nymphomanic one that is looking around New York, looking for the best sex movie. Every thinking and thought about sex is right. You know why? Because every one of us has an image about sex and sexuality. Why we have different images about sexuality and sex? Because talking about sex seems like awkward. It's something that is a little bit shamed, or something that makes our minds moving and thinking about some behavior that is not sure and right to speak about it. Why? Every one of us is seeking for pleasure. Every one of us is seeking about having an intimate moment with us as a person, because I will speak about masturbation, and also with the things that we are sharing about the others, because we are all striving for kissing, having hugs, having forbidden things according to cultures and according to different religions. But talking about sex, as I told you, is different than talking about pleasure. Thus, the way we talk about pleasure is complicated, because we don't know the difference between pleasure, sex, and sexuality, and it's a lot more important that we give it credit for. According to WHO, sexual health is a part of our overall quality of life. It's a part of our quality of life. Because speaking about sex is like speaking about our psychological support, about our personal meaningful life, about our clinical and side effects for everything that you are treating, all of us as physicians. Because speaking about treatment is something very easy to us as medical doctors, but it's something that we cannot implore when we are speaking about sexual education for our patients. It's something shamed, or something that we say, don't import it. There is something very important also to know, that all of us are seeking for pleasure. All of us are looking for pleasure, whether we don't know what is the pleasure and where is it. And for women, which is much more complicated, Please take this into your minds and your offices. Knowing where the clitoris is a knowledge. Knowing where your own clitoris is a power. This is something very important to make in mind as a physicians first, and as a women and as a man that we are sitting to speak about after. The sex was an evolution that is not a real ancient, because thanks for the 14th, but because we have created the penicillin to treat STIs, and while we were treating STIs, we were a little bit aware that STIs are sexual infections, and sexual infections are coming from and for some sexual practices and attitudes that we should look for and see. But however, since the same situation, sex is a taboo and sexual health goes beyond sex itself. Why did no one prepare you for this? Because it's time to put yourself into your selfie camera of iPhone and saying, what is my sexuality? What I am looking for? What I am seeking for as a person to know and to understand much more your sexuality. Thank you also for the pill that was discovered in the 1963, and the best marketing message was, even if you take the pill and even you are going to do the reproductive health prevention and procedures, your orgasm will not be touched. And it was the first time that marketing was speaking about the orgasm and about sexuality. Thank you also to Dalsbad, that was the first sexologist to speak about the body. And thank you also to Betty Friedman that says, please take it into your mind, being a woman is not a disease. Because before, and if we talk about, for example, the Greek culture, uterus comes from hysteria. So when you have the uterus, you're a hysteric person. That was very discriminated as a term and as a woman. And thank you also to Schillheit to be the first sexual educator in the world. But if sex is a basic need, this is a basic question, as basic as water and health and air, how come when we think back to our first listen to it, if I can say to the audience, can you tell me what is the penis in your local language? Nobody will say it to me. If I can say to you, what is the vagina in your local language? Nobody can say it to me. Why? Because sexuality and sex are tightly linked to discrimination, stigma, and above this, to the taboo, because we cannot speak about that. And these are the myths and facts that we are looking to break down in order to have a real sexual life and a healthy sexual life. Because scientists and science continue to be governed by fear, by public opinion, by religious intolerance, by political pressure, and above all, fear of bigotry and prejudice. We have a history of women's sexuality being understood to be the source of disease, ill health, as I told you, for the hysteric and uterus according to the Greek culture. Physical and mental elements were chalked up to hysteria in the Greece, and even some medical textbook on human physiology did not even put the vagina and the penis in our scientific programs because it's a taboo. Thank you to HIV/AIDS that makes us much more open to speak about sexuality and to speak about sex acts. Thus, lack of bodily and sexual information in early age is a fact. Women's sexuality is influenced by their perceptions of their bodies. Negative body appraisals have been implicated in the development and maintenance of sexual concerns. Just to tell you something, my patients in the clinic are, I cannot say obliged, but I recommended to put beside the name and the surname, the nickname of the vagina. Because I don't know my patients from their name or their surname. I know them from the nickname of their beautiful vulva. How is it? So in my different files of the patients, you will have different nicknames that are so beautiful to read and to know. I have Clara, I have the flower, I have, I cannot say it because I want to be back to my country. I have a little and a beautiful, beautiful nicknames, which means that we have a sexuality that we have to take care of specifically as physicians. We know in our countries, I'm coming from Morocco, I'm coming from a very conservative country where the hymen is something very important. The hymen is the significance of virginity. Even if you have put the penis in your ears, in your eyes, in other ways, and you still have the hymen, you're still a virgin. So this is the top of schizophrenia that we are living in, and unfortunately, many of our doctors are simply and always considering the virginity limited to the hymen. So unfortunately, to say that virginity is not limited to the hymen, because I can put it on my eyes, so I'm not virgin anymore. Sexuality of women is often expressed in extremes of approach and avoiding sexual tendencies which have been related to the sexual inhibition that we are living in and sexual excitation pathways under dual control of mother. Please take into consideration this slide, because proper sex education will be a game changer for our overall health and happiness. Power is the key, and the power is knowing your body first as physicians and making your patients knowing theirs. Everyone has the same parts, just organized in a different way. Knowing where the clitoris is, knowledge. Knowing where your own clitoris, unfortunately I don't have one, is a power. And this is something that you should focus also with your patients. Where is your clitoris? And we have a history of women's sexuality being understood to be the source of disease, as you know, ill health, problematic behavior, anxiety and depression. And this is a note that you should also take into consideration when you are treating the women that came to your office. When I'm speaking about clitoris, I'm speaking also about something very important that everyone is looking for. The G-spot. Where is the G-spot according to you? Where? Okay, awesome answer. Awesome. Have you ever discovered one G-spot in a woman with this kind of centimeters? Okay. Another answer? Where is the G-spot? Huh? What? Imaginary. Imaginary, okay. You have never touched your G-spot as a woman. Look, impossible to give an answer. This is also the search and the research of the man, because he's looking everywhere for this G-spot. The man is making his life dedicated to how to find the elusive G-spot and how to blow the mind of the woman to multiple orgasms every time. He can search for it. He can use also the Greifenberg sport, as my dear doctor said to us. And good luck, specifically for a man that has never seen a vagina, because most of the time it's dark, so you can enter and look for, make the precisions in order to know this point. 10 centimeters from the bladder, then go to the clitoris and be to the anus. So good luck to find this, because you can spend the whole your life in looking for the G-spot. It's a desperate search because the G-spot does not exist. It's a marketing size. The G-spot can be on the ear, it can be on my hair, it can be on my it can be on other side. The G-spot is something that is very, very mental position. And when we are saying that the men are having their orgasm by mind, they're not false. Because also women are having orgasm by their mind. And when it's something that is linked to the man, early ejaculation or things like that, everybody is singing Viva Viagra. Because the man is the man. We should find a solution for him. But when we are speaking about the pleasure, the orgasm of a woman, nobody cares. And this is a specific point why I'm making all this theater mention and this theater cinema to give you an introduction for the vaginismus. Nobody cares about the woman, but everybody is caring about the man. Nobody seeks to look for a treatment for the vaginismus. However, the Viagra was since the 17th, and everybody is singing the Viagra, but nobody is singing Botox for vaginismus, psychotherapy for vaginismus, because she is a woman, even though it's the heart and the center of every society and every nation. This makes me introducing the bodily conception, and to be very simple, put your patients into the mirror exercise. I've seen one colleague in Lugano that has a very beautiful divan, and she has a camera in front of the vulva and a big screen. And when a patient is here to make a visit or a check-in, she has the camera and she's looking at this beautiful creature that is the sexual organ of the women. Because everybody is speaking about the vagina. It's not only the vagina, it's the vulva. We have the labia. The labia are not twins, they are sisters, but they are not twins, they are different. We have also the hormones that is a part of our sexuality and the sexuality of the woman. So please make your patients looking to their beautiful creatures that creates the world, which is the sexual organ of women. I come to a very important point to move directly to my protocol for vaginismus, masturbation. Unfortunately for us as a man, we have one way to masturbate. And we're done. Women have million ways to masturbate. I would like to be a woman in order to have these ways to masturbate and to know much more better my body. Because masturbating makes you knowing your fantasies, make deliberating exploration of your mind, spirits, and also your vagina. You must know your body before you share it with someone else. You must know your body, because if you don't know it, you cannot share it. Or you can share it and induce the vaginismus, according to some men. As I told you, I want to be back to my country, so I cannot show these things. To finish, orgasm activates endorphins, which expel cortisol that can relieve stress, supporting our overall health and well-being. The state of high sexual arousal can aid in managing generalized anxiety and depression, and masturbation, please notice this, from a PhD in sexology, masturbation can treat. We can treat with masturbation instead of giving a woman a dildo and say to her, go home and initiate to penetrate +1, +2, and think about your life, think about your pleasure. But we can have a woman that has never had a pleasure in her life for her. So when she's thinking about her incident life and making the dildo, vaginismus became much more worse. So educate women to touch their bodies. Touching is a treatment. These are some publications that I did about the role of body esteem of sexual excitation and inhibition responses for women with or without a history of childhood sexual abuse. You can find it in PubMed. And also another about women's sexual desire and arousal disorder, which makes me speaking about our botulinum toxin. I cannot say more after the awesome presentation of Professor Diana. When you're looking for botulinum barracks or botulinum toxin, you can find some publication, but still now we have a lot of publication concerning the use of the botulinum toxin to treat some sexual disease, but all of this, some use for the aesthetic gynecology. Thank you for the work of my colleague Dr. Giovanni Buzzaccarini in Italy that make a very important review about the vulvar pain and the use of the botulinum toxin, and I can say to you that more than 10 studies spoke about 64% of the treatment and the efficiency of treatment of dyspareunia, then the vulvovaginal dryness, and came after with 6% the use of the borax for the treatment of vaginismus. Pain syndromes that are the main objective of the treatment of botulinum toxin, although several treatment methods has been proposed, but evidence-based therapies are very limited. Therapies can be classified in medical, surgical, and interventional treatment, and unfortunately we don't have a right protocol using the botulinum toxin in this field. I pass away about the bone injection for vaginismus treatment concerning the indication, etc., because Professor Diana has spoke about it. I will just emphasize on the dosage range because we can go from 12 international units to 500 international units. We have 3 kinds of products that are treating the vaginismus, which are onabotulinum toxin A, incobotulinum toxin A, and abobotulinum toxin A, which is this port and which is forbidden for our use in clinic and private clinics in Italy. It is used while lacking. A clear standardization is needed for practical guidelines. Future perspectives should address reproductive protocols for borax administration. Please speak about self-esteem, sexuality, mirror exercise. Give the vagina a nickname because it deserves to have a nickname, and keeping frog not in mind as a message. Women's sexuality is not about what they want, according to Daniel Bruckner, but the other side of desire, the new and varnished norm for female sex drive. As long as we continue to think that men are hardwired for sex and women for intimacy, pregnancy, and babies, we're stuck with the logic that only men really want to have sex and women want to trade it for something else. Better women and men to approach each other as more or less equal partner in lust and work out of the rest in the morning. I finished my presentation with this beautiful painting of Sophia Loren. Strong women don't play the victim, don't make themselves look beautiful, and don't point fingers. They stand and they deal, as Bandy Hale says. Thank you.
Thank you, Christina. Very nice presentation. I have one comment on the G-spot. The G-spot is an old dilemma, but it started 1950s, while Griffinberg, when he described the G-spot in the anterior vaginal wall, 1.6 centimeter, and it is become enlarged when you stimulate it. In the year 2000s, in Egypt, Cairo, in Ain Shams University, Dr. Shafiq, he introduced an electrode inside the vagina, and he could detect there is a electrical wave that is stimulated when you are during sex. In 2012, Professor Adam Ostrozinski, he described the first description of the G-spots. He dissected fresh cadaver, and he described that there is an anterior in the vaginal wall, 1.6 centimeters. There is a group of vein, vessels, and nerve in the fresh cadaver. And he published his study, the new discovery of the G-spot. 2 years later, he described, 2014, he described the histology of the G-spot, that there is a vein, nerve, and there is a vessel. And this is the dilemma. This is now, if you don't believe me, you can examine the...
I cannot, apart believing on your expertise. When I was speaking about the G-spot, in reality, this is a very good product, Zraila, also for the face. But it's not allowed in our country to use it in Italy. This sport is considered as a hospital product for non-aesthetic
I'm not
use.
speaking about the sport, I'm speaking about
this sport. Excuse me.
This is the story of the G-spot, how they discovered the G-spot. This is the story of the G-spot, how they discovered the people. Then the last study of Professor Adam Ostrozinski is the ballooning effect that described by Griffinberg, that when you stimulate your girlfriend or your wife, when you stimulate it, the anterior vaginal wall become. So you can read the studies of Professor Adam Ostrozinski.
You can also find my PhD thesis. It was about the G-spot, in fact, and it was randomized studies that I did in order to make it as a virtual point and as not a scientific point. Because there are some patients, and specifically some women, that are considering a very sensitive point, which is not the G-spot, but sensitive points that they are used to stimulate during the sexual report as the most sensible one. And some our physicians, our confrere physicians, consider it as a G-spot. But theoretically, anatomically, it does not exist.
Agree, okay. Just I want to have a question from the audience. Who have a G-spot? Who believe in the G-spot? Who believe?
I believe G-spot. But G-spot is everywhere. It's everywhere. Everywhere.
Any questions?
Thank you very much, Dr. Samad. I learned one thing from you today. Give me a nickname for every patient.
Can I
Thank you, Dr. Samad. We have one question.
First of all, thank you very much, Dr. Samad, for such a great, excellent presentation. You touched the taboo, which is everybody don't like to talk about. First of all, regarding the G-spot, I can see from the history, you doctor mentioned, it's all men who studied trying to discover the G-spot. I think this one should be done by a woman. Such a study should be done by a woman, not by a man. Second thing, since yesterday up to today, I heard 3 sites for injecting the buttocks for treatment of vaginismus. It has schools or it's upon personal. Yesterday someone said 7 to 9, then 4 and 8 and 9, like that. And today you mentioned only 2 spots. So what?
So if I can answer to my experience for the vaginismus, because it is the first motivation of more than 100% of the patients that came to me. This is the first aesthetic treatment that I'm doing in gynecology. The schema that I gave for the injection was according to different studies that I've take and I took from the PubMed. And then I used them for my patients, and until now, I had less complications and less things. So, as I told you, there is no basic guideline that is approved to be the Bible of the different sites of injection. But the Bible of the site injection is to be healthy, safe, and to have effects, according to me. But I cannot say to you, this is the method and do this for the treatment, because this is mine according about what I have learned from my ancestors in this field.
So you have been injected in another places and you experienced complication?
Absolutely, yes.
Okay.
One regarding the men and female. You know, men are more interested in female body than the female. That's why I tell you something. I dare all the female in this room. If I take your vulva and mix it with another vulva, I dare you could identify which one is yours.
But only the female who can answer where is the G-spot, not a male.
Okay.
Because he is the one who will feel it.
I know something. I tell you something. Most of the ladies, they don't know their private part. They don't look. They don't know where is the direct clitoris and where is the direct clitoral bud. I conducted the courses. I teach a lot of doctors how to do. Then when we come to do clitoral reproduction, I tell them, this is the clitoris. This is the clitoral bud. Believe me, they are a doctor. Some of them, they don't know the difference between clitoris and the clitoral bud. So can you imagine our patients?
Just to add an additional information, the study that we held in Morocco to know what was the first age of the first sexual education for men. Unfortunately, more than 80% of the men had the first experience, please note this, with female sex workers. You can imagine a child with 14 years old with a female sex workers that is a sex worker, means that she has experience in whole life in sex work. So when a child, because 14 years old, according to me, is a still child, having the first sexual experience with a professional female sex worker, you can know that he does not know even what is orgasm according to him. Because the most important in the sexual rapport and the sexual intercourse, according to him, is to penetrate and to have the orgasm, and that's all. So that's why I'm a little bit much more, I do agree with you, because it's not the man, because I cannot know the background of this man according to his sexuality perception, how he has been educated to treat with the female and the women body, because we don't know and we don't have a sexual education, unfortunately. That's why I was fighting for it years, and that's why also I'm a political refugee in Italy, because I've been hiding from my country because I was speaking about taboos, because I insist to implore sexual education, not only in schools, but in every support and information support to make a society aware about their sexuality. So I do agree with you. People should know their body before. It's for men and it's for women. And then we can share our bodies with the others. We cannot share without knowing our own bodies.
Thank you very much, Dr. Samad. I think everybody, we are hungry. Let's go.
Thank you.
Thank you for your attention.
I wanted to take some thanks. I'm from Morocco too, and I want to say that I'm very proud of Dr. Samad. He is from Morocco. So I hope that you do a conference just for men, that you should be found just not for every woman. Thank you.
I will. Indeed, if I find it, I will.
I will in Morocco.
Thank you.
Thank you for your presentation. Thank you. Thank you.
غزلان حبيبتي
تبارك الله على دوك صمد وخلاص.
على النت كثير حساسه بالنسبه لها.